Hey, it's your friend here from Book Podcaster, and today we're diving deep into something super relevant, especially if you're juggling textbooks, clinicals, and maybe just trying to remember what day it is.
Yeah, that sounds familiar.
Totally. We're tackling crisis intervention from Townsend and Morgan's Psychiatric Mental Health Nursing. Think of this as your survival guide to the really important stuff without making your brain feel like scrambled eggs.
Exactly.
Mhm.
We're going to unpack what a crisis truly means, how it can, knock someone sideways, and the incredibly important role you, as future nurses, will play in helping people navigate these stormy times.
Okay.
And remember, even in the toughest storms, there's often a chance to learn and, well, grow.
Okay, let's unpack this then. Townsend and Morgan use the term crisis a lot. What exactly does that look like in the real world?
Well, at its heart, a crisis is when someone's go-to strategies for dealing with life just stop working.
Right.
It throws their whole world off its axis, leaving them feeling
So
completely
unbalanced, yeah.
precisely.
Like maybe if someone suddenly loses their job, that feeling of the bottom dropping out, not just financially, but, their routine, confidence.
Exactly like that. That sudden job loss can overwhelm their usual budgeting skills,
Yeah.
their daily structure, even their sense of who they are sometimes.
Mm.
And the main goal of crisis intervention, as the book highlights, is really to help that person get back to where they were before the crisis hit.
Okay.
It's about helping them regain their footing right here, right now, in the present.
Right. Makes sense. So what are the telltale signs then? What makes a crisis more than just a really, really crummy week?
A few key things. First, crises are generally acute.
Mm.
They usually don't last forever. Townsend and Morgan mentioned a typical window of 4 to 6 weeks.
Okay. 4 to 6 weeks, so temporary.
Usually, yes.
Yeah.
Second, and this is so important to remember, what actually counts as a crisis is subjective.
Huh.
Well, what feels like the absolute end of the world to one person might be something another person takes more in stride. It really hinges on their individual experiences, their background, and the resources they have available at that moment.
That totally rings true. What one person shrugs off, another might find completely overwhelming. I see that.
Absolutely.
Yeah.
And here's where it gets really interesting. Crises, they contain both danger and opportunity.
Danger and opportunity. Okay.
Yeah. The danger lies in the potential for things to get worse. Maybe an emotional breakdown, sometimes even thoughts of harm, unfortunately.
That downward spiral.
But there's also a real opportunity for growth. Think about someone going through a difficult breakup or divorce. It's undoubtedly painful, that's the danger part.
Definitely.
But with the right support, they might actually discover new strengths, maybe a clearer sense of what they want in life on the other side. That's the opportunity.
Turning point potential.
Exactly. And interestingly, some research suggests that individuals who navigate crises with good support often end up with a stronger belief in their own abilities, a greater sense of resilience.
That's good to keep in mind.
Yeah, as a future healthcare professional, understanding this potential for growth helps you approach interventions not just focused on like stabilizing the situation, but also empowering the person's journey forward.
That's a really helpful way to frame it, not just surviving, but potentially thriving afterwards. The book also touches a bit on where this whole field came from, right? The history.
Yes, it does. Townsend and Morgan point to Eric Lindemann's really pivotal work after the Coconut Grove fire back in the 1940s.
Oh, wow.
His detailed observations of how people grieved and reacted to that trauma laid a lot of the initial groundwork for understanding crisis reactions.
Okay.
And then later, Gerald Kaplan, a psychiatrist, he expanded on this with his work in preventive psychiatry, focusing on intervening early to kind of bolster mental well-being and prevent more serious problems down the line.
So they were the pioneers, basically.
You could definitely say that. They really shaped the field.
Fascinating stuff. So when someone is in crisis, does it usually unfold in a particular way? Like, are there typical stages or phases?
Gerald Kaplan actually described 4 common phases that tend to occur. Let's use an example. Maybe that nursing student who didn't pass their critical exam, a scenario I'm sure some listeners can unfortunately relate to.
Oh, the dreaded failing grade. Yeah, my stomach just did a little flip thinking about it. Okay, phase 1.
Phase 1 is the initial exposure to the stressor, in this case, seeing that failing grade pop up, just the initial shock.
Got it. Then what?
Phase 2 begins when their usual ways of coping with stress, maybe studying harder or talking to a friend, just aren't cutting it.
Okay.
So the student might start feeling really anxious, maybe they're having trouble sleeping, or they're finding it hard to concentrate on their other coursework. Their normal stress management techniques just aren't working anymore.
Yep, sounds about right. The anxiety ramps up. What happens next if things don't get better?
Well, that leads to phase 3. In this phase, the individual starts to actively seek help and try new things. Our student might uh, go to tutoring sessions, talk to a professor or counselor, maybe join a study group. They're mobilizing resources, trying different strategies.
Okay, so they're actively trying to fix it,
Yeah,
taking steps.
exactly. They're trying to regain control. But phase 4,
Yeah.
well, that's what happens if those efforts don't lead to improvement or
No.
resolution.
Oh,
Tension continues to build, and you might see more significant disorganization setting in. For our student, this could look like maybe completely withdrawing from their studies, feeling overwhelmed to the point of breakdown, or even experiencing symptoms of depression or severe anxiety.
wow. That paints a really clear picture of how things can escalate if support isn't there or the coping isn't working.
It really does.
So it sounds like it's not just about the stressful event itself, but also how we individually experience it and what resources we have.
Precisely. And that's where Aguilera's crisis paradigm comes into play. It's a really useful model.
Aguilar's paradigm.
Okay. It highlights that the impact of a crisis isn't just about what happened. It's really a combination of 3 key things.
What are they?
First, the individual's perception of the event, how they see it. Is it a catastrophe or a challenge they can overcome? Second, the situational supports they have access to, like family, friends, community groups, maybe even financial resources.
Okay, perception and support. And the third.
The third is their history of adequate coping mechanisms, how they've successfully dealt with tough times in the past. Do they have skills that worked before? All 3 of these factors interact.
Ah, okay. So, going back to the job loss example, someone who sees it as maybe a temporary setback knows they have a supportive family and has successfully navigated job changes before.
Yeah.
They're likely to handle it very differently than someone who sees it as a total personal failure, feels completely alone, and maybe hasn't coped well with big changes before.
That's a spot-on way to understand it. The exact same event, like job loss, can lead to vastly different outcomes depending on those 3 balancing factors in Aguilera's model.
Got it. Now, Townsend and Morgan also break down different types of crises, right? It's not just one generic category of bad stuff happening.
That's correct. They identify several distinct types, which helps in understanding the nuances. First, there are dispositional crises.
Dispositional.
Yeah, these are often triggered by an external situational stressor where there's maybe little anticipation. A really stark example would be domestic abuse, which can lead to profound feelings of helplessness and vulnerability.
That's a really tough one. Okay, what other types are there?
Then we have crises of anticipated life transitions. These are those normal, expected changes in life that can still create a sense of being overwhelmed or losing control.
Right?
Think about a teenager going through adolescence, all the hormonal shifts, identity stuff,
Yeah.
social pressures. That can feel like a major crisis for them, even though it's a normal developmental stage.
Oh, man, I definitely remember feeling like everything was a crisis when I was a teenager. The drama. So true.
Exactly. Relatable, right. Next up are crises resulting from traumatic stress. These usually involve unexpected external events where the individual feels completely powerless and overwhelmed, like surviving a natural disaster, a serious accident, or an assault, and then experiencing things like flashbacks, nightmares, and severe anxiety.
Those kinds of events can just have such a profound and lasting impact. Really devastating.
Absolutely. We also have maturational or developmental crises. These occur when someone struggles to navigate the typical tasks and challenges of a particular life stage.
Like the teenager example, but maybe later in life too.
Exactly. A common example is someone facing retirement. They might experience a significant loss of purpose, identity, and routine, which can trigger a crisis.
That makes total sense. Your whole sense of routine and self-worth can be so tied up in work.
It really can.
Yeah.
Then there are crises reflecting psychopathology.
Psychopathology,
I mean,
meaning related to mental illness.
yes. In these situations, an underlying mental health condition plays a significant role in triggering or worsening the crisis. For example, someone with bipolar disorder might experience a severe manic episode that leads to, say, impulsive spending, relationship problems, or even legal trouble, creating a crisis situation.
So the pre-existing condition makes it much harder to cope with additional stressors or might even be the main driver of the crisis.
Precisely. And finally, the sixth type is psychiatric emergencies.
Okay, that sounds serious.
It is. These are acute situations where someone's functioning is severely impaired and they're unable to meet their basic needs or, crucially, ensure their own safety or the safety of others. A suicide attempt is a critical example of a psychiatric emergency requiring immediate intervention.
Right. Those situations obviously require immediate, intense professional help, no question.
Absolutely. Urgent care.
So, with all these types and phases, what's the nurse's role in all of this? It sounds like a really, really critical position.
It absolutely is. Townsend and Morgan outline the nurse's essential steps, starting always with assessment.
Okay, assessment first.
Yes. This involves quickly but thoroughly gathering information. What happened? What was the trigger? How does the person see the situation? Their perception? What kind of support system do they have? And crucially, as you mentioned earlier, assessing for any thoughts of self-harm or harm to others is the absolute top priority. Safety first.
Right. What kind of questions help there?
Key assessment questions might include things like, what has been happening that led you to feel this way today? Or, can you tell me about what happened just before you came in? And then directly, but calmly, asking, are you having any thoughts of wanting to harm yourself right now? Or, have you thought about harming anyone else?
Getting that initial understanding and safety check must be so vital.
It's the foundation. The next step is planning.
Okay.
This involves setting short-term, realistic goals together with the individual. It's about identifying available resources and collaborating with the person on a plan. It's not about the nurse just telling them what to do.
Working with them.
Exactly. For example, helping someone who's been displaced by a house fire find temporary shelter and connect with aid organizations. Very practical, immediate steps.
Focusing on those immediate practical needs makes sense. Stabilize first.
Precisely. Then comes intervention. This is the action phase.
What does that look like?
It's where you use a practical here-and-now approach, offering support, empathy, active listening, and helping with problem solving. It could involve just sitting with someone who's highly anxious, listening without judgment, and maybe helping them break down their overwhelming problems into smaller, more manageable steps they feel they can tackle.
So really being present with them and helping them think clearly when they might feel completely lost or overwhelmed, grounding them.
That's a great way to put it, grounding them in the present. And the final step in the nursing process here is evaluation.
Checking if it worked.
Essentially, yes. It's the follow-up to see if the interventions were effective, if the initial goals were met, and if the person needs any additional support or resources moving forward. It's closing the loop.
So it's a complete cycle, really. From understanding the crisis to ensuring the person is stable and has a plan for moving forward.
Exactly. And Townsend and Morgan also lay out a slightly more structured crisis intervention process itself, which builds on those nursing steps. It has 4 distinct steps.
Okay, let's quickly walk through those 4 steps too.
Sure. Step 1, as we've basically covered, is assessment. Re-emphasizing safety. Is the person safe? What was the precipitating event? How do they perceive it? What are their usual coping mechanisms, and what supports do they have? Getting the full picture.
Right, the fundamentals.
Step 2 is planning the therapeutic intervention. This is where you set those short-term, achievable goals, identify specific actions or interventions, and again, really stress working collaboratively with the individual.
It really keeps coming back to that partnership idea, doesn't it? Empowering the individual, not just dictating.
It's absolutely fundamental to effective crisis intervention. Step 3 is the intervention itself. Putting those planned actions into practice, providing ongoing support and reassurance, encouraging expression of feelings, and creating that safe space.
Doing the plan.
Right. And step 4 is evaluation of the crisis resolution and anticipatory planning.
Okay, what does anticipatory planning mean here?
It means looking at how effective the interventions were in resolving the immediate crisis, but also helping the person think about future coping strategies. What did they learn? What resources can they use if a similar stressor happens again? It's about preparing them for the future, too.
Got it. Building resilience for next time.
Exactly.
So pulling it all together, what are the real key takeaways from Townsend and Morgan that we, especially nursing students, should remember about crisis intervention?
Okay, several crucial points stand out. First, the absolute necessity of a swift but thorough assessment to understand the immediate situation and, above all, any safety risks.
Assessment first, always.
Always. Second, the critical importance of creating a safe, non-judgmental, and supportive environment for the individual. Trust is key.
Makes sense.
Third, as we've emphasized, it's about working with the person, empowering them to find their own solutions and build on their existing strengths, rather than just imposing external fixes.
Collaboration.
Right.
Uh,
The partnership. And finally, always remember that crisis intervention is primarily focused on the immediate time frame. The goal is stabilizing the individual and helping them return to their pre-crisis level of functioning, or perhaps even a slightly higher level thanks to new coping skills learned. It's about the here and now.
Okay, so that's been a really insightful deep dive into crisis intervention from Townsend and Morgan. Wow.
It's a lot, but so important.
Definitely. Remember, everyone listening, when life throws you or someone you know a curveball that feels impossible to handle, understanding these phases, these types of crises, and the crucial role nurses play is absolutely key to helping navigate those tough times and find solid ground again. And as you're juggling everything, your studies, clinicals, life, just remember that even the biggest crises are usually temporary, and reaching out for support, just like you're learning to provide for others, is a real sign of strength. Seriously, you've absolutely got this.
And maybe consider this. How might understanding these principles, these frameworks, not only be invaluable in your future nursing career, but also in just being a more supportive and helpful presence for the people already in your own life when they inevitably encounter unexpected challenges? Something to think about.